The third objective will come, and research will lead to against waste and abuse. Health, so citizens will be empowered, the people that will giving services will be empowered to know about waste and abuse and our overall impact. Failed to participate in capacity development, research and learning. National level stakeholders and TI will lead us in engaging those. I understand that these facilities are the ones that are going to participate in the first diagrammatic research and learning. I will give you upon each other that we want to achieve after abilities between at the interface of public program, not that because looking at corruption is just research. The next objective in that research is to influence health sector governance. So we want to see, subscribe to a Kakamega Private Health Sector Association. Do you have a code of within the private healthcare institutions? We were to use the EACC, but we found that EACC will be skipped and other areas of governance. After we have trained the TOTs, we are going to support those TOTs now to organize workshops within their counties to be.
Comes to issues of pricing, I think as an organization we'll have to sit down and see how to regulate things like pharmaceutical things, the non-farms, but sometimes what we call consultation again is at variance. It depends. Are you a consultant? Are you a clinical officer? Yeah, we have the baselines. So those baselines will be able to tell us in this profession you will charge so much, and that would really be able to bring down some of these costs. And if we have those service charters that my chairman was talking about, then you go to a facility knowing at Anointed this is what we charge. At another clinic, Rafa, this is what we are charging, and the public can be able to look at it. And you, the media, you need to get information. Sometimes even a quack will overcharge you and you blame it on a doctor has overcharged you on a private. Sometimes there are even a private arrangement that you are being overcharged about, and then you say, no, these people are extravagant. But I think the issues of insurances, we know we have facilities that are also overcharging the insurances, but I think that requires a policy that should be able to regulate all these things. Some of us have stopped treating insurance patients because even the insurance themselves even delay paying our rebates. So sometimes you don't see why you continue seeing patients.
Our role in this program will be to actually for capacity building, and first of all do a research to make sure that our clinics are well, and then after that they identify the gaps. Then next we'll be involved in doing the research of our service delivery, and most of our team will be working with the private sector where we are now. We need to have clinics that have service charters. So service charters will be able to explain what kind of services offered and their prices and the minutes taken, time taken. Otherwise, we expect all good clinics to do the minimal standards like that. But people have gone so far to overcharge clients. So in private, we really don't entertain people overcharging clients. Service delivery is actually a simple mechanism where we can use to assist our people. But when you overcharge a client, then you are doing actually havoc. We just want a pharmacy to operate pharmacy, and if it's a clinic, achukue license from the respective bodies and then a clinic. Otherwise, those doing other things, they're just after money, of which we don't encourage. And anything to do with expired drugs, that's poison. Anyone giving an expired drug is poisoning the client. So we as Kakamega Private Health Sector, we will dig down to the clinics within Kakamega County and be able to come up with at least a code of conduct. Later on, we give them our code of conduct and we give them our rules and subscriptions of which they are supposed to meet. And we have standards by the government. So we should expect all clinics to operate within the standards. so that we don't have those ups and downs. The quacks are the only people who can do those things. But we as Kakamega will be on the forefront of making sure that at least the standards are followed to the key, so that we are able to give our people the best delivery so far.
The third objective will come, and research will lead to against waste and abuse. Health, so citizens will be empowered, the people that will giving services will be empowered to know fraud, waste and abuse, and our overall impact. Failed to participate in capacity development, research and learning. National level stakeholders and TI will lead us in engaging those. I understand that these facilities are the ones that are going to participate in the first diagrammatic research and learning. I will give you upon each other that we want to achieve after abilities between at the interface of public program, not rather, because looking at corruption is just research. The next objective in that research is to influence health sector governance. So we want to see, describe to us, Kakamega Private Health Sector Association. Do you have a code of within the private healthcare institutions? We were to use the EACC, but we found that EACC would be and other areas of governance. After we have trained the TOTs, we are going to support those TOTs now to organize workshops within their counties to be